You have about 30 seconds, and those 30 seconds make or break. That's your first impression. And if you can't engender some trust with them right off the bat, they're really not going to trust you enough to tell you what's going on and to allow you to help them.
Today's guest is someone who has lived nearly every role in EMS, from EMT to paramedic to ER physician. Dr. Jeff Jarvis is the Chief Medical Officer and EMS Medical Director for the Fort Worth Office of the Medical Director, where he helps shape the future of pre-hospital care. He's also the host of his own podcast, the EMS Lighthouse Project Podcast, where he breaks down research and makes it practical for providers in the field. He loves research. In fact, I had to keep him off of research for a little bit, or we would have gone into a rabbit hole we would have never got out of. In this episode, we talk about his journey through EMS, what he's learned as a medical director, how to build trust with patients in those first critical 30 seconds, and why research and critical thinking matter more than ever in our profession. Let's get to it. Dr. Jarvis, welcome to the podcast.
Thank you, Matt. It is great talking to you. Thank you for having me on, and congratulations on starting a new podcast.
Thank you. You were actually the inspiration for this. Many years ago, I asked you for some advice on AV equipment, and you gave me the setup, and I just ran out and got everything you told me to get, and it's worked out great. So thank you.
So when the audio quality for this podcast comes out bad, it is all my fault. I see what you did there. That was very good, Matt.
No, it is my fault because I changed platforms right before we started recording, which I would not advise doing. So
I think you're going to be fine. I think Riverside's going to do great for you.
I think so.
So I don't remember that conversation, Matt. What did you end up getting?
I got the Rodecaster Pro and the Shure SM7B, the Michael Jackson microphone, and it is what it is. But I'm
a Rode guy. I got this Rode. I have that Rode right up there. I have a Rode up here, and I have another Rode over here. Plus all of my wireless. I have a Rode Goes. I'm an Australian fan. I like the Aussies.
Yeah, they make some great products. I love their little microphones, some of the clip-on microphones. I have an identical setup at home, which is lovely. So thank you for the recommendation.
Congratulations, man. I'm excited for you.
Thank you. You are our inaugural guest. So if there's applause or cheers or something like that, you're it. The reason I wanted to have you on the podcast is because you have an amazing background. You started out in EMS, and you are one of the rare people who knows what it's like to go from EMT to paramedic to doctor. So take us back to the early days. How did you become a paramedic? What got you into the profession?
You bet. I figured out very quickly that I was not cut out to be an engineer, and I decided to do something else. So I got into emergency services as a volunteer firefighter. I grew up in a rural East Texas town, just north of Houston, Cleveland, Texas. Go Indians. And I joined the fire department, loved it. When I went to A&M, I went there I wanted to be a programmer, and there wasn't really computer science back then. It was electrical engineering. So I started taking all the engineering classes and realized that I really sucked at calculus. And around the same time, A&M had a volunteer EMS agency. I joined up, I took an ECA class, and I just actually before that, I took a first aid class, and a guy named David Phillips, that I think you know, was my instructor. He was there at A&M at the same time, and we became, honestly, lifelong friends. He's one of my best friends. He is my son's godfather. I'm his daughter's godfather, one of my best friends I made there. And he just got me hooked. So I did the ECA, then EMT, then special skills, back when special skills was a thing in Texas. And then me and him, a guy named Tim Martin, Dudley Waite, me, Tim, and David are still around in EMS here in Texas. And then Brad Bledsoe. We all piled into cars and went from College Station down to Houston Community College 2 to 3 times a week for about 9 months to finish our completion program there in Houston. So that's how I became a paramedic.
Wow. What was your favorite part about being a paramedic?
So I'm still a paramedic, and I still think as a paramedic way before I think as a doctor, which those aren't different, by the way. I think they're very complementary. I loved just being able to walk into somebody's house at one of the worst times of their life and establish a rapport with them. You have about 30 seconds, and those 30 seconds make or break. That's your first impression. And if you can't engender some trust with them right off the bat, they're really not going to trust you enough to tell you what's going on and to allow you to help them. So the ability to get that relationship started off right, boy, was that a skill I didn't have early. And what I have realized, I thought being a paramedic was all about poking holes in people and doing these cool procedures. And what I realized is that wasn't it at all. It was about establishing these relationships with people right off the bat. And I thought it was a great challenge, and I just loved it. When I did decide to go to medical school, it's what drew me to emergency medicine. Not that it's not important for other specialties, but other specialties typically have a little bit longer to make that relationship.
Yeah. So in order to change from one thing to another, we usually have to be pretty unhappy with something. Did you get to a point where you were unhappy with being a paramedic or feeling discontented? What made you finally pull the trigger and go to medical school?
You bet. So there were a couple of things. There was something I was unhappy about. Good God, this is in the Wayback Machine. We're going to have to go way, way back to like 1993. I was the Texas State EMS training coordinator, and I was taking a look. I was responsible for rolling out the new EMT basic curriculum and would have been responsible for rolling out the new paramedic curriculum had I not left and gone to Temple College. What I realized going around the state teaching the instructors about the new basic curriculum was that this was a massively diverse state, and the needs of the EMS system were massively diverse. I was looking at the draft curriculum that they were talking about for the paramedic curriculum, and it was a greatly expanded knowledge base, wildly beyond where it ended up. And I honestly didn't think there was any way possible that we were going to be able to require all new Texas paramedics to achieve that curriculum. I just didn't think it was going to happen. So I said, if we can't make everybody get up to that level, maybe what we can do is just create a new certification. And I said, this is a great time to just make a new thing, and we'll call that a licensed paramedic. And then that will be someone who's gone through an accredited associate's degree program in EMS that teaches this new scope, new knowledge base. And then we will continue to maintain a certified paramedic is what it's always been. So we got that passed, and I was pretty involved with helping. By the time that legislation rolled around, I wasn't at the state anymore, so I could actually get involved with trying to help it pass. And what I saw through that and 3 subsequent legislative sessions was that vision get watered down to the point now, if you ask people what the difference between a licensed paramedic and a certified paramedic is, they'll tell you it's the color of the patch. And honestly, that's probably about the only difference. So I was a little frustrated with government and that the rest of the state wasn't on board with pushing paramedicine in the direction that I thought it needed to go. So that was the frustration part. At the same time, Niall Barnes, who was an instructor, he's now a doctor of pharmacy. At the time, he was teaching at Austin Community College. He agreed to get me to write the pharmacology chapter for this new paramedic curriculum for Bledsoe's paramedic book. This was when he went to like the 5 versions. I took a look at what the curriculum said about that pharmacology and realized I didn't have the chemistry background to really understand it. So I went back and took inorganic chemistry, 2 semesters of that, so that I could take organic chemistry and understand this well enough to write it. And in the meantime, I went ahead and wrote it anyway. But while I was there, I realized that I absolutely love science. It was like a light went off in my head. Sometimes when you're a freshman in college, I was not mature enough to really grasp onto what science was. And, my science background from East Texas Public School was you memorize some facts, and that's what science is. Well, it turns out that's not at all what science is. That's boring as hell. Once I realized that science is just an organized way of answering questions, it's all about sating your curiosity. then I was hooked. And I got convinced to take the MCAT because as Rachel Neely, who is now an EMS or an emergency physician, she was taking the class with me. She was an ER nurse at Baylor Scott and White, or at Scott and White at the time, long before the merger. And she was taking the class with me at Temple College. There was like 4 of us in the class. So if you have to take science classes, I strongly recommend Temple College. It's great, small classes, great instructors. And Rachel brought a bunch of MCAT review material and left it on my desk. And I said, "What's this?" She said, "That's what you're going to study for the MCAT with." I said, "Why would I want to take the MCAT?" She said, "Because it's painfully obvious to everybody around you that you need to go to medical school." Fine, I'll take the test. And by then, I think she got through to me that, yeah, I wanted to go and be a medical director.
So that then you went to medical school and everything's been easy since then?
No, and thank God it hasn't been easy. I think if everything was easy, it would be pretty boring. So getting into medical school, it's just a thing you have to do. You work hard and do everything you can to, you have to apply. You have to write an essay. You have to build a case that you should be allowed in. And I said, if I'm on the admissions committee, and I was the chair of the EMS program at Temple College, so I was on admissions committees and I was looking at applicants. I said, what if I were on an admissions committee for a medical school? What would I want to see that would convince me that this Jeff Jarvis kid should be, I was 33, should be allowed to join our medical school class? I said, well, number one, you have to address the grades as an undergraduate. So I said, all right, how could he convince me? Show me that he has academic rehabilitation. So I just made sure that I did something like 60 hours of post-baccalaureate science classes, plus a master's degree, and made A's in all of it. So I applied myself and said, what I would need to see at the end of the road is perfect grades. So I got perfect grades. I said, I would need to see a high MCAT score, so I studied for the MCAT. Certainly not a perfect score, but it was pretty competitive. And I'll need to see an essay that explains why I'm a different person now than I was when I was a college student. So I wrote that essay. So in other words, I started my process of my application by picturing what the end product should look like. And then I wrote that history. I mean, it's just a thing you do. Once you understand what you need to do, you just set out and work hard and do it. Medical school itself was really more fun than, it was definitely hard work, but the science was really cool. So I just enjoyed it. And by the time I hit, say, 3rd year of medical school, which is classically the first 2 years are like a really condensed basic science crash course. So that was just more school. And I studied. That was my full-time job. I hit clinical stuff. I'm sorry?
How did your paramedic background help you through medical school or hurt you?
Definitely did both. So by the time I hit my clinical years, it had been probably 2 years since I'd touched a patient. I had forgotten how much I enjoyed that rapport, establishing those relationships. So being back doing medicine, I really went to medical school to be an EMS medical director, not to be a doctor. Thankfully, in 3rd year, I realized that I actually kind of like this doctor stuff. So how did being a paramedic help? It certainly gave me the inspiration to do it, but becoming a paramedic is not easy. You help people achieve that goal all the time. And I'm sure that what you tell them the first day of class is, this is hard work. You need to learn how to work hard. So I did. And that really helped me do well in school. It also hurt me a little bit. I knew that I wanted to do emergency medicine because that's the easiest path to be an EMS medical director. And it's by far the coolest specialty. So I just want to throw that out there. I knew what I needed to know to be an emergency physician as a medical student. Turns out I was completely wrong. I had no clue what I needed, but I would study a lot of basic science stuff and think, I don't need to know that. I'm going to be an ER doc. As it turns out, you need to know that. I may have been 33, 34, but I was still kind of an arrogant young paramedic. So that part hurt me. But the ability to talk to patients, do an assessment, clearly skills were helpful. That part helped.
You've been the medical director for a couple EMS systems. What's the viewpoint from the medical director, and what keeps you up at night?
What is the viewpoint? So clarify what you mean by that before I take this off in a direction that is not at all what you had in mind.
As a paramedic, we typically one patient, one call, and sometimes we don't always understand what's important to the medical director. Do you have a speech that maybe you give your people about expectations, how they make good decisions? Tell us about the framework or your expectations maybe as the medical director.
Yeah, so I do. I talk to all of the new paramedics every time we have a hiring process. And I do give them my expectations. I let them know that I think the practice of medicine is really something sacred. It is something that you have to take very, very seriously. And I let them know that EMS, being an EMT, being a paramedic, is the practice of medicine. Just disavow yourself of any notion that what you're doing every day is not the practice of medicine. It absolutely is. And that sacred trust is about a relationship, and you have to take it seriously. This is not just a job. You are going into people's houses, you impact their life, and you need to take that seriously. I talk to them about what makes a good clinician, and what makes a good clinician isn't your ability to start an IV or intubate upside down in the rain. So if you're intubating upside down in the rain, you're doing it wrong. Stop that. The skills, the procedural success isn't what makes you good. What makes you good is your empathy, your ability to talk to patients, your ability to make that rapport, and then your ability to make really good decisions. How do you make good decisions? By studying yourself, by always working to learn more, and by having some humility. So we talk a lot about that. So my expectations are that, number one, you not be a dick. So we make things way more complicated than they need to be. Brand new paramedics in particular are really worried that they're going to screw up because they're going to miss an IV. They're going to screw up, but it's not because they miss the IV. Hell, I miss IVs all the time. So what? It just happens. What they're going to screw up is because they're a dick. They abuse that trust that people have given them. That's really how you screw up. The way you get fired as a paramedic, the way you get fired as a doctor, is by being lazy. So you didn't show up to work. You kept showing up late. You let your partners down, and you were rude to your patients. You forgot that the EMS, the S stands for service. You're a servant, and what it means to be a servant is to put the needs of your patient above yourself. They forget that. They think the patients are there for them. That's how you end up getting in trouble. So I talk to them about what medicine is, what's sacred about it, what is incredibly rewarding about it is that relationship, and then how they can screw up. And it's not the way they think it is. So in terms of, there is a little bit of a mind shift, and you brought up the issue of one patient at a time. Clearly, this started to go off in my head. That's individual medicine, and that is wonderful. You get to make those relationships. That's the best part of medicine. In grad school, I went to a public health school, and as I'm studying epidemiology and public health, I realized that is the medicine of population health. And then I brought that framework to EMS as a medical director and realized we build systems for population health, not at the expense of the individual, but you have to take a look at the entire population. So when you're writing protocols, you're not writing a protocol for the latest, greatest whiz-bang thing that could have happened that one time at band camp. You write it for the entire system and the entire population. So that's a slightly different mindset about how you approach the job as a medical director. What keeps me awake at night? Honestly, it's the phone going off for call all the time. And to be clear, that's the job I signed up for. It is not the fault of the paramedic who is calling me. That's their job. I've asked them to do that. And it's my job. If I didn't want to get up in the middle of the night, I wouldn't have signed up for this. It is an honor and a privilege to be able to be on the other end of that phone. But I'm not 35 years old anymore. In my mid-50s now, I find that I still am pretty good about going from completely asleep to fully awake. I am really bad now at going from fully awake to back to sleep. That whole sleep latency thing has me. So that's the thing that keeps me awake at night. It's not that I don't trust paramedics that I'm working with, I absolutely do. It's not that I trust them not to make a mistake, because they're going to make a mistake, just like I do. All of us are going to make mistakes. Medicine is not perfect. It's not excusing them. It's just recognizing reality. I personally think I should be able to fly, but I'm not going to jump off the top of my house, because I recognize reality says that I'm going to hit the ground really hard, and next time I show up for a shift, probably going to make a mistake.
Yeah. Dr. Jarvis, you're known for being into research. In fact, you have the EMS Lighthouse Project, which you talk about a lot about research. Without going too deep into the wormhole of research, because I know how much you love it. And
Too late. You just opened that door.
I opened that door. Let's just crack it open and briefly tell EMTs and paramedics why research is so important and why we should probably be doing more of it in EMS.
Sure. So you know that protocol that pisses you off so much? That protocol that says you should give adenosine to SVT when you know you've given it, and you make people feel like shit. And you've seen them in the ER, and maybe the doctor doesn't give adenosine. Maybe he gives diltiazem or verapamil, and the rhythm converts and they don't feel like shit. And you're like, why don't we do that? And you go to your medical director and say, I want to do it. And he's like, show me some evidence. That's why. If you don't like the practice that you have right now, you need to talk to your medical director about the evidence for why you should be doing something else. You have to build a case based in reality and based on what works. We grow up as doctors all the way through medical school in a very science-oriented program. And by the way, that's none of this shit about we focus on disease and not what the root cause is. That's crap. Anybody who tells you that's selling you something. We absolutely do. But in order to understand the root cause, you have to understand the science. So we speak the language of science. And if you want to have a change in your system, if you think what you're doing isn't working, that there's something better, you need to understand what's better and be able to prove it. And that's where research comes in.
If somebody is interested in it, what's a good resource that they could use to get started?
You bet. First, you have to do 7 years of a PhD before you can even read a research project. Sarcasm here.
Yeah.
I actually thought that. I just read a book. It was Carl Sagan's The Demon Haunted World, Science is a Candle in the Dark. Great book, by the way. I think I've recommended it to you before. I love that book. I know you're a book nerd too. I love that book. What it made me realize is I can actually learn science on my own. By the way, if you want a PhD, more power to you, go get one. But you can just reach out, grab a research paper and read it. So what if you don't understand all the parts? So what if you get to methodology and don't know what the hell a chi-square test is? That's all right. Turns out you have the entire body of knowledge of everything the human race has ever known available by ChatGPT or Google. Just go look it up. You read something in the paper and it says, we did logistic regression. Go find out what logistic regression is. Doesn't mean you have to be able to do it, but you'll get a general understanding of it. So that's one thing. Just start reading abstracts. Now, a note on that, the publication industry really is not set up to help foster science. That means if you want the full paper, it's almost always behind a paywall and you got to pay for it. Do not pay for it. Ask someone with library access, hey, can you get this for me? We will get it for you. But the abstracts, the brief summaries of the papers, that's available. You just Google search PubMed and type in the topic you want. Click on one of the articles and you'll see the abstract. The abstract gives you, it's a structured summary of the paper, tells you what the background is. Why is this important? It'll say what question they were trying to answer. That's the objective. Then it'll give you the methods. How did they go about answering that question? What data did they use? If it's an experiment, what two things did they compare? Then they'll give you the results, and then they'll give you their conclusion. And after you've read that, if you're interested, then email one of us. We'll get you the PDF. Then read the paper. When you see something you don't understand, go learn about it. Next, if you've done that and you are really interested, let me put a blatant plug in for PCRF. Do a web search for PCRF, the Prehospital Care Research Forum. This is an organization based at UCLA, but it's national. Dave Page runs it and does a great job with it. The whole idea is to take EMS clinicians who may not have a background in research, but are interested, and they help them learn how to not only read research, but do research. So you'll do some online classes, Research 101. You will spend less time every year going through the HIPAA training and the don't grab people's asses training that you have to do 15 times a year that you sleepwalk through. Less time than that to take Research 101. And then you come to one of these forums. So ESO hosts them. They're in Austin all the time. They are 2 days, so a half day, full day, half day. You come in, they pair you up with an experienced researcher and an experienced statistician. They give you a data set, whether it's the NMSIS data set, the ESO data set, the image trend data set, and they help you structure your question, set up the methodology. That's why you have experts there to walk you through it. Those experts explain why you're using a logistic regression instead of a t-test. And then they will go off, do the stats, and by the end of that workshop, you have written an abstract, and then you presented an oral form. Then after that session, you continue to work with your group and your mentors and statisticians to turn that into a manuscript. So you get real world experience doing the research, you get contacts, people who are doing research all the time, and you come out with an abstract, you come out with a paper, you can present it at EMS World, NAMSP, all over the place. You may get a manuscript, and you definitely get a much deeper appreciation for research and how to read research papers. So I cannot plug the PCRF enough.
That's great. That's a really wonderful opportunity, especially for our students here in Austin. So
yeah, definitely sign. ESO hosts them with PCRF 3 to 4 times a year. I think the next one is in September.
That's great. You mentioned AI. How do you think AI is going to be changing EMS?
It's interesting. I think, how is it going to change the world? I can tell you there is the optimistic version and the pessimistic version. The pessimistic version is Sarah Connor is somewhere every time you click on ChatGPT, she's going, this is the reason we deserve to die. So yes, there's the Terminator version. The first one, the good Terminator, all the other movies sucked. The first one was great. And yet I can see that's a problem. I don't really think that's where we're going to end up. There are some downsides to AI, and I'd be more than happy to nerd out with you about them. But then there is also, I think, the helpful part of AI. Let's just assume that we don't get to generalized knowledge and we don't end up with a Terminator that rules the world. But what we do get is something that is really good at synthesizing knowledge and answering questions. So I use ChatGPT. I subscribe to it. I think it's a great tool. In the words of Ronald Reagan, it's great, but you got to trust but verify. So it can hallucinate. Make sure that you're verifying what it tells you, but you can use it to answer questions. You can use it to help you learn. So I'll frequently ask it to pretend like I am a student trying to learn about something. As an example, Bayesian analysis. This is the one. ChatGPT's done a great job of teaching me this. And teach me in the Socratic method about Bayesian analysis. So it will do it in the Socratic method. Again, you have to confirm that it is what it's saying, but you can ask it for additional resources and then go check those resources. So I use it a lot to help me understand new things. I use it all the time to help me with coding. So I just finished up my first Bayesian analysis, as a matter of fact, looking at the difference between first pass rate, and subsequent failure. So first pass success and then subsequent failures. The tube is in, great waveform capnography. You lose capnography, it no longer works. You got to pull it, put a different airway in. So that's my definition of subsequent failure. So first pass and subsequent failure between King LTs and the air Q. And Chat helped me write the code to do the Bayesian analysis. I could have gotten there on my own. It would have taken me probably a month to learn how to code it and then code it. And I was able to get through it in about a week, thanks to Chat. So I think we're going to see a lot more of that. Your students probably use it to, hopefully they are, to quiz them on their curricula. You can say, hey, Chat, talk to me as though you're Socrates and you're trying to teach me how to do a physical exam or, acid-base balance, whatever it is. So I think that's the primary way.
You had a wonderful line, and I don't know whether this is politically correct, so I hope I'm not stepping on any toes. But at one point you said, "Have chat teach me like I'm an East Texas redneck." And
Yeah.
the idea is that sometimes chat can give you this huge 3 or 4 page dissertation on something that's really simple. And I have used that language to say, teach me about this. And it's like, okay, so you and I are sitting on the back of a pickup truck and we're going to do a barbecue, right?
Yeah,
and it breaks it down in a way that you really understand it. And again, I'm not trying to step on anybody's toes here. I don't know how else to say it in a way that, break this down so that I can understand it. I mean, that's probably the way to do it, but.
Yeah, no, that was my line. And so I went, as I mentioned, East Texas Public Schools, about 30 miles and what seems like 30 years before Dr. CJ Winkler. CJ was a paramedic in Austin before going to medical school. He's now the deputy medical director in San Antonio. He's a great guy. Feed him some beer and you will never stop laughing. You should put on some Depends because he'll literally make you pee all over yourself. Really funny guy. And he likes to do something that firefighters and orthopedic surgeons like to do. They are brilliant people, but they like to pretend they're stupid. It constantly drives me crazy. CJ does that. He plays up the East Texas redneck to make you think he's stupid, to lull you into this sense of complacency. And then he opens up this can of academic whoop on you and makes you realize you just got taken. Yeah, he was asking me, he was pretending to be stupid and asked me about Bayesian analysis. So I said, hey, Chad, explain Bayesian reasoning to me like I'm a East Texas redneck. So it talked to me about hunting.
Yeah, things that you can relate to. That's great. So I'm going to open a little bit of
I'll tell you what, there's one other thing about AI, if
Sure.
you don't mind.
Yeah.
A lot of people think there's the Sarah Connor is going to hate you level of AI gone amok. But then there's the next level, which is probably something we really should worry about, which is AI is going to take my job. So if I was advising young people, like say my son, what career to go into, I would probably not recommend being a truck driver. So as it turns out, being a truck driver is a great job right now. AI can absolutely drive a truck. And I really worry that it's going to displace truck drivers. By the way, the most common job in America. So it can displace those folks. I am really glad I didn't go into radiology because AI for the non-interventional radiologist
Exactly.
is going to do a better job than most human radiologists. I wouldn't want to be a pathologist. But you know what nobody is clamoring to have a robot do is pull that thing out of your ass that you slipped on. There is nobody that is going to ask you to do disimpaction. Nobody that is going to come help your stupid drunk butt up off the floor. That's our profession. And boy, I think we're safe.
I think we are too. And I think the trades are safe for a while. There's been a huge shortage, micro, foundation, all of that. So if you can swing a hammer, if you can do plumbing, electrical work, be an EMT, be a paramedic, I think we're going to be okay a little longer than most professions. If you look at advertising, marketing, a lot of those folks right now are looking like, in 30 seconds, I can have a pretty good answer to most things. So
yeah, absolutely. Yeah. My son's doing HVAC stuff at ACC. I think he's going to be in. People are going to want their houses cool. We live in Texas. It ain't going to get any colder.
Nope.
So.
As Warren Buffett says, nothing makes me happier than millions of men shaving their face every day. So
right.
HVAC repairman in Texas.
Yeah.
He's going to have a long career for sure.
Buffett's a smart guy. You can't go wrong.
Yeah.
Listening to him.
So as we kind of start wrapping up, how do we make EMS better? You've been doing this for a long time. You've seen the pros, you've seen the cons. We've seen some of the flooding and stuff that came out of Kerrville, and it seems like there's some gaps in EMS. How do we make this profession better?
Yeah. As you were saying that, all I could see was Dr. Pickett going, fix yourself. Yeah. So one thing we can do is just tell paramedics they're stupid. And the whole reason the system isn't great is because of them. That may feel good to say, but it's not very productive. And it overlooks the fact that it is probably our fault in leadership, our fault as instructors, our fault as EMS leaders that the system is where it is. So overall, and I don't think many of your listeners will disagree with me, EMS is not valued as a part of medicine. Part of it is our identity. Are we public safety? Are we public health? We don't recognize that we're the best of both. So we don't fund it. Clearly, we don't fund medical care very well in the U.S. at all. So there are some structural things I think we have to do to better recognize the value that EMS brings. That's really hard to change. If you're an individual paramedic, what I would recommend is that you get involved politically, and that I recognize it is like you'd rather go shoot yourself. I was trying not to say that. We don't need any more encouragement to commit suicide. Unfortunately, suicide is a very high prevalence in our field. It's not much fun, but there are easy ways to do it. Number one is join your professional association. So join NAEMT. They have an event. They have a PAC. I don't like contributing to PACs either. Yes, it makes me feel dirty. I have to go, shower afterwards, but that's the reality we live in. And that's how bills get passed. So join NAEMT, go to one of their Day on the Hill events. I've done these with ACEP, NAEMT, and NAMSP, where you get together in groups of other EMS professionals and you go meet with your representatives and you tell them the problems that you're seeing and what will help. That representation matters. So do that. Get to know your local elected officials, your mayor, your council members, your county commissioner, and let them know that what you do matters. But that's what you can do from a big system standpoint. What you can do individually is recognize the value you bring and find value in it yourself. When I thought my entire worth was built around whether I could intubate or start IVs, what I found is that I was not very happy. And when I realized the value that I bring is that human connection with my patients, that relationship, EMS became much, much more rewarding for me. It became much more meaningful for me. And now I'm coming up on my 40th year in the profession. I didn't go off and do something else because I found what the value was for me. So that's what I think we can do if we are all doing a better job establishing that relationship, benefiting our patients, being true servants. Then I think that puts the reality on the ground in a much better place to make the political argument. So if you're making the political argument that we provide this service and the politicians look around and what they see is a bunch of unprofessional people driving in an ambulance that's dirty, not maintained, you may as well go to Walmart and get accosted by the Walmart greeter who thinks you're there for them. It's going to make it really hard to make the argument that we're professionals, but if you're behaving like a professional, it makes that argument a little bit easier.
Yeah. What haven't I asked you?
Probably could have gotten a better answer from ChatGPT, but that's the one I got.
Well, you're here now, so
that's right. Take what it's opportunity cost, right?
Have you seen the study? Have you seen the study? Of course you have. Have you seen where ChatGPT is lowering like IQ points or something just by one-time use?
I have not. I haven't seen that study. I can absolutely see it. How good are you at multiplication or division?
Multiplication, I'm pretty good. Division, yeah.
150 times 232?
Playing this game here.
That's all right. Don't answer, because if you do, I'm just going to sit here and blink at you. Not like I know. How good were you in the 6th grade?
Probably not that good.
Wow. I'll tell you what, when I went to the 6th grade, we didn't have calculators. Okay, and we had to learn it, and we did it every day, and I was really good at it.
Yeah.
If I get 2 + 2 right now, I'm thinking I did a good job, because I have this computer sitting right in front of me that is amazingly smart. So it's a crutch. Now it allows me to do things like logistic regression, but I'm not as good at basic math anymore. I can probably still remember my phone number, and yes, it was a rotary dial, from the house I grew up in. I don't know my daughter's cell phone number because I just say, hey, Dingus, call Sydney. Yeah. So I'm getting stupider because of that. And ChatGPT, I promise you, I could probably learn how to code faster before ChatGPT than I can now because it becomes a crutch. And I think the key to that, I think this is where you and I have talked about this before. I think outside of being a parent, the most important job in the world is being a teacher. And what our teachers can really help students do is don't teach them how to learn or don't teach them facts, teach them how to learn and how to critically evaluate information. And if you do that, not only do you inoculate them against misinformation, but you teach them to recognize the bullshit when it might sleep through in ChatGPT. But you teach them how to use it as a tool, not to replace your ability to think, but your ability to do short-term tasks.
There's a phrase, do the hard things. And I really like that. And I have found that sometimes I want to do the easy thing because ChatGPT is totally the easy button. But I'm finding that I want to, I don't want my brain to atrophy. I don't want it rattling around any more than it already is.
Right.
So I am doing the hard things instead of, clicking it, help me, like, okay, why don't you try and figure this out for yourself so that someday you can keep doing this. The other thing I've seen with ChatGPT is it'll give you the wrong answer. And it's almost like you have to have experience as an EMT or experience as a paramedic to know what's right or what's wrong. And that is one thing that I worry about our students using it and saying this is the answer, and they don't have that knowledge to say that's a hallucination.
Yeah. So it's interesting because, and this probably goes for politicians, it goes for car salesmen, it goes for everybody. Honestly, in most of the world, this is not good, but this is human nature. You don't have to be right. You just have to be convincing. And if you come across as absolutely confident of your answer, there is no doubt. You know this is the thing. People will believe whatever you're selling, like whatever wellness influencer is going to convince you to buy their supplements. So they are so convinced. There is no doubt for them. And you'll buy that. So the older I get and the more I think about thinking, the more I recognize the most important words to me are I'm not sure. And I think to the extent to which chat could give us an answer to something and then tell us what its level of certainty is and be a good Bayesian, embrace the uncertainty, I think would probably all be better off. But we really do just need to teach people how to trust but verify. Go back to that Carl Sagan book. He introduced this concept of the baloney detection kit. This book was written in the mid-'80s. It is still it's probably more important today than it was then. Go back and read it. And he really talks about the importance of being able to critically evaluate information. A demon-haunted world. A demon-haunted world.
Demon-haunted world.
A demon-haunted world, science as a candle in the dark. That concept of science as a candle in the dark, my podcast is all about translating knowledge from science into practice. And when Mike Verkest and I were trying to come up with a name for the podcast, we may have been about 4 bourbons into it, but I was telling him about this book, and we came up with the concept of a lighthouse, where science is our lighthouse. It's the candle in the dark. So it's a great book. I can't recommend it enough.
Yeah. What haven't I asked you about that you would like to share?
My latest thing is about Bayes, so I would be more than happy to talk about Bayesian analysis. But that might be a little bit much. I'll tell you, you can ask me about how the hiring is going for a position we have open. I would love to do a little recruiting here. So I'm the chief medical officer for the Fort Worth office of the medical director, and I'm the medical director. We provide medical direction for the Fort Worth EMS system, now a part of the Fort Worth Fire Department. We are hiring a critical care paramedic educator to help us push the limits of what's possible in pre-hospital medical care. So if you're a critical care paramedic, if you are an educator, if you have a fascination with learning new things and help redefine what EMS can be, come to work in Fort Worth with us. Love to have you.
That's great. How long do you think that position will be open?
That is a great question. So I have been a government employee for about a month. And what I'm realizing is we move at the speed of government. So we're having to reclassify it and do all sorts of stuff for HR. what I am learning coming from a pseudo-private industry to a government industry is the priorities are different. We always say run government like a business. Government is not designed to be a business. A business is designed to be efficient. A government is designed to be accountable. Both very valid things, but if you come from an efficiency standpoint, looking for efficiency in government, you're going to be disappointed. We will get this position right. We will, all of us, be accountable for it. But it has taken a while, despite everybody working really hard on it. So I suspect it'll be open for maybe a month or so.
Yeah. All right. Dr. Jarvis, thank you so much for your wisdom and for memorializing that in a podcast. I love the fact that we can have a conversation. We can share it with people from now until Sarah Connor and the Terminator come back.
The downside to this, as somebody who just passed episode 100, is there are an awful lot of things that you have memorialized that turned out to be wrong. And you're like, oh, maybe we need a catastrophic disk failure, and maybe those will get taken off the internet. Nope. The internet is forever.
I don't know if it was you, but somebody was talking about research that half of what we're doing right now is wrong. The problem is we just don't know which half until time goes on.
Yeah, that's the classic thing people always say the first day of medical school. There are two things they say, and nobody actually says this, by the way. Take a look at the person on your right and the person on the left, and in 3 months, only one of you will be here. That's bullshit. You get into medical school, you're going to finish. And the next thing is, we're teaching you an awful lot of things with a great deal of confidence, of course. Half of it will be wrong. We just don't know which half.
That's why they call it a practice of medicine.
Absolutely. Science is an evolving thing. It's not about the answer. It's about getting as close to you as you can to what the answer is. Absolutely. If you think you have found truth, you're selling something.
Yep. If you haven't listened to the EMS Lighthouse Project, Dr. Jarvis does an amazing job making research palatable for even those people like me who have a hard time looking at research and truly understanding it. So thank you for the work you're doing. Until next time.
Take care, Matt. Thank you.
What I love about conversations with Dr. Jarvis is that he brings together the heart of a paramedic and the perspective of a physician. His message that EMS is not just a job, but the true practice of medicine should resonate with every EMT and paramedic listening. If you want to dive deeper into research and leadership in EMS, check out his EMS Lighthouse Project Podcast. And if you're considering the next step in your own career, remember what Dr. Jarvis emphasized. Our value comes not just from procedures, but from the relationships and trust we build with patients every day. If you'd like to become an EMT, a paramedic, or even earn your bachelor's degree in EMS, visit EMTSacademy.com or scan the QR code on your screen. At EMTS Academy, we train the next generation of EMS professionals from the classroom to the field. Thanks for listening, and remember, the world needs more people who can stay calm, think clearly, and save lives. Until next time, stay safe.